I'm Dr. Langley, a family medicine doctor who also happens to be a lactation consultant. Today I wanted to talk about causes of pain while breastfeeding. I know I've said it many times myself, and that's what they all say, is that breastfeeding is not supposed to hurt. So that's a sign that something is going wrong. There's two things that you have to look for a new mom getting started with breastfeeding, or any mom, is that baby is growing and getting some good milk, and mom's not in pain. If that's both of those aren't there, then there's something that needs to be fixed. So if it's not supposed to hurt, why does it sometimes hurt? By far the most common cause I see of pain with breastfeeding is nipple damage caused by a shallow latch. So if you're especially early in the first 6 weeks after having given birth, definitely get some help with getting your latch assessed. See how you can get more of that breast in baby's mouth. I mean, they talk about it being breastfeeding, not nipple feeding. There should be a lot of the areola. Women all have different sizes of areolas, but a lot of it in baby's mouth, as much as possible, in order for baby to really be able to remove the milk effectively. Your nipple is actually made to be all sorts of stretched out in baby's mouth. It stretches all the way from the front of baby's mouth to the back of baby's mouth, and it doesn't hurt when it's working right. But if it's not there, if baby doesn't have enough breast in baby's mouth, the nipple will be pressed against the hard palate of baby's mouth, up near the front of baby's mouth by the tongue, and that is painful. What the nipple needs to do is you need to have enough breast in baby's mouth that the nipple actually gets stretched all the way back to the soft palate, way back. You can feel in your own mouth, way back in your mouth where it gets more mushy, less hard as the front of your mouth. And that's where the best milk removal happens. That's where the breast was made to go, where the nipple was made to stretch, and that won't cause the same kind of nipple damage and pain as you'll get when baby is getting enough breast in baby's mouth. But there's lots of other ones too, and there's lots of different ways to solve breastfeeding pain. The number one thing that I want to do right away, though, is cross this off. There's lots of people that will tell you that your breast just needs to be tougher, maybe during pregnancy, that you should rub a washcloth across your nipples a couple times a day to toughen them up so that breastfeeding works. Please don't do that. It really isn't proven to help, and it has the potential of causing other irritation and damage. But the rest of these are all true. Sometimes when mom and baby are having a tough time getting along, what they really need is more skin-to-skin time together, time to relax, get connected to each other, strip baby down to just a diaper, mom be topless, and just hang out in a safe place for as long as you can. Just relax, be together, nurse on demand, and spend the hormone exchange that happens during those times seems to work wonders for all sorts of issues. If you're still having breastfeeding pain, get assessed. You can look online for ideas of how to improve your latch. There's little tweaks that you can learn, especially with your first baby, like having baby's shoulders facing the same way their head is. Sometimes babies all sorts of funny with their head turned this way while the rest of their body's facing that way, and that would be a really hard position to eat in. So aligning their body, their hips, and their shoulders all facing the same direction against mom's body, ideally with their hips bent and their knees bent. That tends to make them a little bit more comfortable. So little things like that can make a big difference for babies and moms too. Also look into laid back breastfeeding, laid back position where baby is on top of you instead of you kind of leaning over baby and hurting your back and shoulders. That can work wonders with baby getting a chance to move his or her head around and navigate breastfeeding on their own. Keep in mind when you're bringing the breast into baby's mouth that it should be a sandwich and not a taco. It can be hard to figure out based on where baby is and where your hands are how to line it up. But there's many times when you're just not thinking of it that way and you're trying to get the breast in that way into baby's mouth, and that's too big this way. It's like trying to fit a taco in straight. When you eat a taco, you got to turn your head sideways or turn the taco sideways or a little bit of both. Same with breastfeeding. You want to mush the breast in a way that's going to help baby get more of it into his or her mouth. Sometimes after a bad breastfeeding session, you just need to take a break. You need to relax, get away, have a little bit of time to yourself. So keep in mind that that's an okay thing to do. And then there's professionals, lactation counselors, lactation consultants, or IBCLCs, La Leche League leaders. There's lots of people out there that want to help you. And if you think there might be a medical problem wrong, go see a doctor. I listed some more possibilities for the causes of the pain. Let's see. We talked about shallow latch. Mastitis is an infection of the breast. Usually it's hot and swollen and red in a certain spot on your breast, and that's the giveaway for that, not so much nipple pain. Sometimes women's breasts get sensitive during their ovulation or during their periods if they've returned to that after giving birth, and so the breasts are just tender for a couple days, and that stinks, but there's not much we can do for that. Sometimes it's a case of yeast or thrush. If you have it can sometimes look like a small rash over mom's breast or nipple, or sometimes there's nothing there at all, but just shards of glass sensation coming into the nipple, especially when baby breastfeeds, or even sometimes between breastfeedings. And usually baby will have signs of overgrowth of yeast as well, such as thrush, which is little white spots in the baby's mouth that aren't milk. You can brush away milk, but you can't brush away thrush with your finger. So that would be something to get in and see your doctor as soon as possible. I have to do another discussion of the medication options with that in another video sometime soon, so stay tuned. Skin damage usually is going along with a shallow latch for another cause of pain, and that's pretty obvious. But there's also the less common things like Raynaud's or vasoconstriction, still present in lots and lots of women, where the blood vessels just kind of freak out sometimes. And then the nipple, that's an extra sensitive place where the blood vessels, if they're not working well and they're not supplying blood the way they should, it will cause a lot of pain. Typically, people with Raynaud's syndrome also have pain in their fingers when they go out in the cold. Sometimes their fingers will even turn red, white, and blue. Very patriotic of them, but very painful. And their nipples can do the same thing. Red, white, and blue nipples, especially with cold air or with nursing. But there are medications that can help with that, so talk with your doctor. If baby's not feeding well and you're getting engorged with a lot of milk, that can cause breastfeeding to be painful. Nipple dermatitis or psoriasis, just like you can get it on skin, you can get it on your breasts or nipples too. So that's something to consider seeing a doctor for and getting proper treatment. And the last one that I happen to list is plugged ducts. These are, I don't really know why plugged ducts happen, but some women seem to get them more often than others. There's all sorts of different ways to try to resolve that plug to let the milk flow again, from solutions like for mastitis with like a toothbrush handle that might vibrate and help break things open, or warm heat, or sometimes you can see the bleb or the plugged duct that you can pick at and get it open. So this is kind of an overview of different things that might cause you pain while you're breastfeeding. I hope it pointed you in the right direction of perhaps another Google search of how to get things better for you and for baby. I have more lactation specific topics if you want to watch some other things, or if you wouldn't mind subscribing to me so you can see when I release another video. Thanks for watching.